Hi, I'm Dr. Jack Cush of Rheumnow.com. Today we're going to talk about dealing with stress. I'm joined by Tina Brown, a patient with psoriasis and psoriatic arthritis, a patient educator. And Tina's been teaching patients for many years about dealing with their disease. How are you, Tina?
I'm doing great. Thank you so much.
I'm so glad that you're here. Why don't you start by telling us about how patients are dealing with stress right now, and how you talk to patients about stress from all your educational endeavors.
Well, one of the things that I share with patients a lot is how important it is to be their own advocate, to take responsibility for their own health and to do everything that they can to keep themselves healthy, learn new things, try new things, and be open to any new treatments that they can be. Because I think a lot of times patients are struck with fear and they're not really sure what to do. So the patients that I've talked to lately that are really dealing with some anxiety around this virus, what to take and what medicines, and if they're on biologics, having questions around those, I tell people, talk to your doctor, be smart about it. And more importantly, with this time of being quarantined and people being in their homes, this is a chance to really take advantage of time to focus on their health, focus on their sleep, make sure they're eating healthy, make sure they're getting proper exercise, stretching, doing yoga, and more importantly for dealing with stress, for me personally, and what I've taught patients for years, you have to self-nurture and take care of yourself and feed your spirit. Keep your mindset really positive. You know, we're bombarded with negativity everywhere on the news, and one of the most important and really only things that we can control about ourself right now is our mental attitude, and keeping a positive mental attitude is absolutely crucial in this time of negativity and fear everywhere.
So that negativity is fueling the fear, and fear leads to some really poor choices by all of us, not just patients, even doctors and whatnot. You know, how can people avoid the non-decision when they're fearful, and make the right decision instead, whether it's about whether they go outside or whether they take a medicine? I mean, what do you tell people?
Here's what I tell people. Most people are not present in their life. I tell people this all the time. It's one of the biggest challenges people face. And right now, being fearful and worried and full of negativity, you can't think creatively. You can't be your own advocate. You can't make good health choices. So I think the most important thing for people is to, every morning when they wake up, spend some time reading inspirational or positive things, getting their mindset right. The experts say that the first 30 minutes of your day is the rudder of your day, and how you spend that and setting that tone for yourself and getting quiet and listening to your own inner voice. You know, we're all smarter in our intuition than we realize, and just getting quiet and using some basic common sense and directing your thinking toward what's positive. Because when people get negative and fearful, it cripples their creativity. And it creates, as you know, as a physician, it creates a lot of negative emotion. It creates even more inflammation and challenges in the body when people are afraid. So I think controlling the mindset is one of the most important things that patients can do right now to keep themselves as healthy as possible.
So in another interview this week with Dr. Kevin Winthrop, he said, in dealing with this, it's time to hit the pause button. It's time to lay low. It's time to focus on yourself. That's kind of what you just said. And I think that is really important, that this is an opportunity to think right, do right, and be more positive and creative about any changes that are going to happen in your life in the next few months.
Well, and it's a great opportunity. This is how I've explained to people. I've been somewhat grateful that I've been grounded for the last 3 weeks, because it's actually enabled me to take the time that I need to get my medicines together, to work on my routine, to do everything that I can to keep myself healthy. So everything that's happening, we can deal with it in a positive or a negative way. So I have always encouraged people, look at the silver lining, look at what's great about your situation, and the fact that we can actually be at home, rest, take care of ourselves, eat healthy, do all the things that we need. It is an opportunity for us all to establish and create and continue good, healthy habits that are going to serve us even after this virus, because eventually the virus will be handled and we'll be able to get back to a normal lifestyle. So what we do right now is going to greatly impact our future. So it's a real opportunity for patients to take better care of themselves.
So when I talk to patients about either how they got into a flare or why they're worse, or how they can avoid those things, it's been very clear to me over the many years that people get into bad situations when life changes, when life throws them a new wrinkle, when they have to stop work, where they have to go on a family vacation or go to a funeral, etc. And when they get out of the routine, when they move away from stability, when they stop doing the things that have always worked for them, that's when they get into trouble. And that's what you're talking about here.
Absolutely. And I believe you have to do the inner work and the mental discipline each and every day to create those sorts of mental habits so that when a disaster happens or when a crisis comes, you're prepared for that. You know, there's a great book by Harvey Mackay that says, dig your well before you're thirsty. And I love that topic because right now is a chance for people to be digging deep within themselves to find inner resources that we all have that go untapped that we can use, but you have to stay positive and creative. And if you succumb to the fear and the negativity of what's going on right now, then you can't make the best decisions for yourself.
So I've heard a number of scenarios and stories this week where what's been crippling is that, again, this negativity and fear has led people to check out, meaning they're checked out from their jobs, they're checked out from their family, and I'd say this is a really bad situation because those folks don't have a plan and they've totally withdrawn and they're setting themselves up for disastrous outcomes. I think those people need to not just reconnect, but they need to lead or be led. So if you want to check out, that means you need to be led because you're not going to lead.
Well, and let me just say this. I think we all have a responsibility to take care of ourselves and be the very best that we can be. I think it's a little bit, how do I say this? I think it's important for us to realize that we all have an impact on our loved ones and the people that we're around. If we check out in a time of fear, instead of doing everything we can to be positive and upbeat and inspirational, then we're affecting negatively everybody that's in our world. We have a chance right now to be our best self. We have a chance in the middle of this crisis to rise above what we normally might not do. We've got a chance to show our greatness and to bring our very best self to the game. And that is an opportunity. When I talk to people that are so afraid and afraid to leave their house, I tell them, think about what you can do. Think about the controllables. Think about what is positive and what you can be grateful for, and use that instead of making yourself a drain on other people, because everybody in our circle needs to be uplifted and inspired. And checking out for me it's not an option because we are still living life. Life is still going on. Granted, we may be locked up in our homes or our offices, but life is still going on, and checking out shouldn't be an option for people because we're going to get through this.
So I want to make a shout out to folks who may be prone to anxiety and depression. This is going to be a particularly hard and harder time for them. I think it's very important that they connect not only with their families, but also with their doctors about being well equipped, having the right guidance, the right medication, whatever it is they need to get through this. They cannot do it alone. Now's the time to get help and ask for help. And again, be part of a group as you get through this. So I want you to end, Tina, by giving patients a few goals that they can take away in dealing with stress during the time of COVID.
One of the things that has helped me, and you've been great to support me on this, Dr. Cush, sleep is the most important thing, I think, in dealing with stress. I got a Fitbit, and every morning the first thing I do is I wake up to check my Fitbit to see my sleep quality. I've made sleep a really big priority in my life. When people are not well rested, they have more of a difficult time dealing with stress. I think self-care is critical. The things that you can do for yourself that are positive, being able to stop, become self-aware, talk to yourself like you would a loved one, be able to set yourself up for success. And that's the mental part of this whole experience. You have to learn and set a goal to be positive and be mentally prepared for what we're dealing with. And number three, more than anything, stay on a routine, create a routine with your medicines, your exercise, stretching, doing everything that you can to keep yourself healthy. I know for me, if I don't get up and move around or stretch, do some sort of yoga or meditation, then I don't do well. So I'm trying really hard to stay in a routine.
Tina at tinabrown.com. You're just a resource that's so invaluable. I appreciate you taking the time and talking to our patients about how they can deal with this. We'll see you soon.